Greetings. My name is Hunter Occhialini.
My name is Herman Arita.
And I'm D'Angelo Brown.
And this is our presentation on the Black Death. So the Black Death originated between the years of 1347 and 1352. It had originally coined this iconic name due to its ability to have the infected flesh turn black due to the gangrene that has affected it.
Classifications. Black Death is classified by its scientific name, Yersinia pestis, its domain, bacteria, its order, Enterobacterialis, its class, Proteobacteria, its phylum, Pseudomonodonta, and its morphology, gram-negative. The pathogenic agent, which causes the Black Death, Yersinia pestis, is able to grow anaerobically, which means without oxygen. It's able to survive phagocytes, which are responsible for killing bacteria. And it's able to survive these phagocytes because it secretes proteins that disarm them. And once it disarms these phagocytes, it's able to make its way to the immune system and kill off any immune cells, which are your protection against infectious diseases like the Black Death. And the Black Death also infects zoonotically. So it naturally survives within rodents and fleas, and then humans become infected via contact.
The timeline of infection. The Black Death mainly spread due to the war efforts and ships traveling, including trade and all the other stuff. The routes all got infected because of that. In 1346, it's starting out in Mongolia. Their war tactics of throwing infected bodies over the walls definitely led to the higher volume of casualties caused, and that essentially spread out all the way until 1350, where it eventually slowly started to die down. In 1351, it started to diminish due to the European physicians bringing up the idea of quarantine, which is prevalent to what we are currently going through. So I can see a lot of relations to that. Then in 1353 is when life slowly comes back to normal, with the feudal system dying down, meaning more freedom for the people to do whatever they want, easier to get a job, and better wages for everyone. And all that freedom eventually led to the Renaissance era. As for the identification methods, being a bubonic plague, it's very easily identifiable, mainly by the skin types and skin discolorations. The Black Death, called the Black Death, had black spots all over the body, so it was very easy to find out if someone had it or not. Alternatives for that, if they wanted to be more confirmational, they would take blood samples or samples of the affected area, usually a swollen lymph node gland, taken for testing. They will usually find out from there.
Some of the ways that it spread were through trade routes, but to be more specifically, it was shipping trade routes. A lot of the people that carried the disease over to new areas, and from there, that trade routes only got even larger and spread to even more areas. Other ways this infection spread was actually due to a lot of conflict in certain kingdoms. A lot of the towns would be bombarded with dead bodies of previously infected people to therefore spread the plague even further. With all these different means of it spreading around, it had caused a few different variations and a few different waves of this plague to occur within a short period of time, each one having different infection rates. Some were faster, some were slower.
All right, so once Yersinia pestis invades and attacks you and breaks down the immune system, it can cause several symptoms such as fever, headache, blackening, and death of the tissue, which gave name to the Black Death, bleeding from the mouth, and severe weakness. And all these symptoms are developed over the course of around 2 to 8 days, so about a week.
How it kills. So saying you possess this disease, how would it affect you? Having the mortality rate being very high, a lot of people would die from this no matter who you are. It's very likely you'll die from this. How it happens is it travels through the bloodstream, bypassing the immune system to spread, which is a very critical point of how it kills so fast and easily. The noticeable symptoms occurs in 5 days. You'll start to notice black dots around your body, extreme pain, and you can notice your body just shutting itself out. And yeah.
The Black Death's life cycle was actually divided amongst two different areas. There's the Salvatic cycle and the urban cycle. The Salvatic cycle is when the plague was contained within the bodies of rats and fleas and other insects like that. And the urban cycle is when the Black Death has been infected or been contracted by a human being. Even though these are two separate cycles, they feed off of each other. The more people that get infected and die from this disease, the more rats and fleas will then be able to have this disease carried by them to more people, therefore increasing the spread and increasing how deadly it was.
All right, for areas infected, we can see this map showing all the areas as indicated by the yellow dots. Starting in Europe, it slowly spread mainly due to war, trade routes, and people being selfish overall, higher ups, which eventually leads to the feudal system. Later on, as time progresses, you can see the disease actually spread towards the west and to North and South America, unfortunately, but that's later on, about thousands of years later.
All right, so public health issue. With regard to attempts at containing the Black Plague, they were done very early on in its life cycle. In 1347, the Italians had first attempted to close down their ports by rejecting certain ships, and the ones that were allowed to pass had to isolate for 40 days, which gave rise to the term quarantine. And 2 years later in England, the king of the time, King Edward III, focused heavily on poor public hygiene being the sole cause of the rapid spread throughout England. So what he did was he moved the burial pits away from the larger cities where there was a higher likelihood of it spreading around to more and more people. And he also ordered a mayor in London to clean out the streets due to feces, which led to even more infections. And despite these attempts being very early on, the plague still spread very, very rapidly. And the European population actually decreased by up to 60% due to the plague, with its high mortality rate of up to 75%.
As for the religious effects, religion during the Black Death heavily skyrocketed due to the fact of the mysterious and how deadly the disease was. It led to many people seeking other outlets to hopefully find a solution to this unstoppable, as what they saw, of a plague. Mainly, since the fatalities increased, two main views arose, which was the Roman Catholics and the Muslims. Although they are distinctively different, they both share a common goal that the plague was caused as a result of God punishing everyone for their sins. And that eventually led to the rumor of Jews being responsible for the plague, as people saw that their beliefs wasn't doing anything to benefit or help themselves from the plague. They blamed it on the Jews, which eventually led to the first massacre of 40 Jews being killed in Providence. This eventually led to the Flagellant movement. The Flagellant movement is essentially when people would harm themselves in a way to ask for forgiveness for God, and that eventually did not work, which eventually led to religion being a high cause of the death from the Black Death.
The mortality demographic rate, this chart shows you how deadly this virus and bacteria actually was. With untreated patients having a mortality rate of over 85%, and just having one simple treating of antibiotics can drop that all the way down to 15%. With standard bacteria that prize on the immune system, it is much deadlier to younger generations and older generations than it is the average male. But not all methods were actually good. Modern day methods consist of quarantines and antibiotics such as doxycycline, which are actually really effective at stopping this bacteria and saving the patient. However, some older methods didn't really hold up to the test of time. That including avoiding showering and exercise, thinking that getting dirty was getting dirty with the disease, uh, wearing religious medals, thinking that their god would prevent the disease from spreading to them, and even carrying on pieces of paper with magical words such as abracadabra, thinking that this magic would actually help protect them from the bacterium itself.
The end, question mark. So, as with any bubonic plague or any pandemic in general, as is currently happening right now with COVID, there is usually never an end. A lot of people think that the bubonic plague for the Black Death has officially ended in the 1300s. That is not true, as there has been cases recently reported as recent as 2020 in China. But with the modern medicine amount around in this day and age, we have nothing to worry about. But the Black Death is still definitely around, and I believe it is very much related to the COVID pandemic we have currently on right now. And now we will move on to the multiple choice questions.
So, if you're arriving in a harbor and your ship was suspected of having someone with the plague, what do you think would happen? Is it A, the boat and all its passengers were burned immediately? B, you were not allowed to dock and were sent away? C, you were held on your boat for 40 days? Or D, none of the above? The correct answer is C. You were held on the boat for 40 days and 40 nights. This would ensure that any signs of the contagion would have already been shown by now, and it would help actually ensure that any of their measures of quarantining were effective.
Which of the following reasons did Europeans not believe was the reasons for the Black Death? A, sin, B, polluted air, C, rats and fleas, or D, Jews? The correct answer is C, rats and fleas. Although all of these is a possible reason, the only factual reasoning is C, fleas. They were not aware of rats and fleas being the actual cause of it, which is the reason why all the other answers are possible choices.
And due to the collapse of the feudal economy of Europe, what effects entailed after this? And the answer is A, it was a labor shortage, because obviously with a massive amount of people dying, you're going to get a shortage of the labor supply.
Here is our works cited references, and that is it. Thank you very much for joining us in this presentation about the Black Death.